Mark Holland is the federal health minister. Hi, Minister. Good to have you back on the show. Thank you for making the time.
Thank you, Vassy.
Is it your intention as a government minister to introduce universal single-payer pharmacare?
It's our intention to do what we did today, which is to announce coverage of diabetes and universal contraceptives. And we need to see how that lives in the world. You know, we have a pilot out in PEI. In PEI, that kind of looks to fill in the gaps that exist between private insurance and folks who don't have coverage. This one's different. It's based on a single-payer universal model. But, you know, we need to see how both of those models live in the real world, evaluate them, see what kind of costs are involved, and also the committee that we're establishing is going to determine costs and looking at the way forward. So right now, we're committed to making sure that Canadians get the medication that they need, and the cost isn't a barrier to that. The exact way we get there is still being evaluated.
So do I take from that the NDP's framing of this, that your government has committed to ultimately introduce a system like that, is wrong?
Well, I think the NDP has made it clear that they're sold 100%, that the end state is going to be single-payer universal pharmacare. For me, I want to make sure that the system that we choose is the most efficacious, that it gets us there the most efficiently way possible. And so we have to evaluate the different models, which is most cost-effective, which is most effective in terms of patients. And I think not having that be an ideological debate, but actually having real-world examples of the two different systems operating and seeing their relative benefits, and really having this committee drill down so that we understand what the costs are. I just don't think it's responsible without knowing the exact costs and exactly how it's going to be funded, or exactly what you're going to do with insurance companies, as an example. Without having clear answers to those questions, I don't think it would be responsible to proclaim ourselves. I think taking it a step at a time, just as we did with Medicare in this country, moving gradually forward, each step building on the other to improve it. I see that very much what we're doing here today.
With great respect, though, I don't think to the NDP it's ideological. I think they've based their view on a series of studies that have been released over decades, including one very specific one led by Dr. Eric Hoskins, and a committee of experts in 2019 that did come to the conclusion that exactly that, a universal single-payer system would most benefit Canadians. Are you in disagreement with the conclusion that that committee reached?
So what I would say, Vassy, sorry, I certainly don't mean to characterize their position as ideological. What I'm saying is I don't want to be ideological about it. I want to be driven by science and data and facts. And what I'm saying right now is that, just as an example, how much would a single-payer universal system cost? We don't know. How would you pay for such a system?
Well, the PBO, with great respect, says it's an extra $10 billion a year.
Well, but
so we know.
You know, what we want to know, well, no, but we know is that there's a PEI model, and when you fill in the gaps, that's one particular way of doing it, and there may be advantages to doing it that way in terms of doing it faster, doing it for less money, doing it in a less disruptive way. Then there's advantages with a single universal system, which also would get people all the medication and drugs they need at no cost. But with that system right now, we don't know how much it would cost. We don't know how you would fund it. You don't know what you would do with displaced insurance companies. So those questions have to be answered, and we need to look at both of these things existing in the real world to be able to evaluate them. And I think that's why it's so important to take this step, because diabetes drugs and contraceptives represent an incredible opportunity, not just to improve the health of patients, but also a preventative power to reduce cost and to avoid further chronic disease and illness. I think actually what we're doing here today is going to save the health system money on a net basis.
So for Canadians who are watching tonight, just so that they're clear, because they are getting some competing messages, right? I mean, sometimes correlating, sometimes competing from your government and from the NDP on this. The NDP is telling them your government, through this legislation, has committed to implement that universal single-payer system. What you're telling them tonight, and please do correct me if I'm wrong, is that what you have committed is to do that in these two instances and then see how it goes and evaluate the prospects for the future. Is that accurate?
Yeah. Yeah, I think we're taking a look at how this is going to go. We're evaluating it in science and data. We're taking a look at what the real world costs are, about how we're going to be able to work with provinces and territories. And then we have a committee that's going to be looking at the entire essential medicines list, as an example, and really understand what the costs are involved and what's involved in potentially expanding that. And at the same time, we have the PEI model. And the PEI model has been enormously successful in making sure that patients get the drugs they need by by filling in the gaps that insurance companies don't. So having those two competing models existing in the real world, I think really what the Canadians care about is that we have a system that gets them the medication they need, and that they're not faced with choices of, do I pay for my food or do I pay with my medication?
But they are,
just quickly,
faced with that issue with great respect, Minister, right? That's
sure.
What informs the NDP's push, is that 1 in 5 Canadians don't have their drugs covered. You could fix that by implementing a system that they think that you've agreed to, but you're saying tonight that you won't. You're waiting for more information.
Well, no, I don't think that's fair. I think that what we both said is that in diabetes and in contraceptives, we can move now. And that means that for a patient who needs diabetes medication, that they can get it. That means that somebody is not going to reuse a syringe because they don't have the money to buy a clean one. It means that somebody isn't going to skip their medication with the potential consequence of their limb being amputated. That doesn't mean that there's not other needs in the system. But to just say that we're going to do it without knowing how much it's going to cost or how we're going to fund it, or looking at the evaluation of how it exists in the real world, I think that what we're simply saying is let's be iterative on this. And that's why the step we've taken today is so important. We're going to look at it. We're going to evaluate it through the use of science and evaluation. We're going to take a look at what that next step is. And at the same time, we're also looking at the PEI model. But our objective is the same. And I think that's the thing to focus on, is not the debate upon which system, because I'm going to be moved by the system that most represents the best value and the most efficacious and efficient route to achieve that goal of making sure that everybody gets the medication they need.
Minister, I know we just have a few minutes left, and I do want to turn to another subject or another file that you're overseeing. That was the release of the documents concerning the 2 scientists from the Winnipeg lab that were fired back in January of 2021. Do you regret fighting so hard to keep those documents a secret? Was it a mistake?
Well, that's just not true. What happened in 2019 when this discussion began, there was an immediate offer for NSICOP, the Oversight Committee of parliamentarians, to look at that information. Remember, here we're talking about employees being fired, personnel information. That is all covered. We're not supposed to release that. And by the way, that wasn't our decision. That's the decision of the Public Health Agency under very strict adherence to the Privacy Act. But what we wanted to do immediately was for parliamentarians to see that. Now, a number of parliamentarians and opposition parties made the point that if you did that and there was a disagreement on redactions, then how are we going to make sure that people can see additional information? So I agreed with that. I was the House Leader and I said, okay, let's create an ad hoc process where parliamentarians can look at this, refer the documents to arbiters, let the arbiters make that decision, and then move through that process. But because we're dealing with employee information and national security, that did take time. And the end result of it was that all of this information was released, and the normal considerations of protecting employee information were waived, and I think rightfully so. And Parliament did its job, and we frankly did our job to make sure that those documents and information were released.
Minister, you skipped a step. You took the issue to the Federal Court of Canada. You applied to the Federal Court of Canada in June of 2021 to quash what happened in the House of Commons when the MPs there voted to see what was in the documents. You went to court. That is actively trying to keep the public from seeing the documents.
Well, no. What had happened at that point in time is the opposition said NSICOP wasn't enough. They wanted to table drop those documents. They wanted to just have a process where the law clerk could go through them with no controls, with no expertise on national security. That would have been completely reckless. That's an inappropriate way to deal with classified information and employee information. Can you imagine if you're an employee of the federal government and you find out that documents are going to be handled that way? So what we said at the time was,
why didn't you set up a committee at the time?
We need to have a controlled process.
Why didn't you
set
up
I wasn't
that?
The House Leader, but I became
you were a member of the government.
the House Leader. Yeah. So what I think was, look, this is to go back in time. Prior to the 2021 election, there was a very heated debate in Parliament about whether or not to use NSICOP or not. And we ended up having an election. It truncated that process. We came back. I was the House Leader, and I said, let's not have this debate. We shouldn't be fighting over national security. These redactions are done on highly classified items. These redactions are done by the Public Health Agency. We need to have a process that is fair and independent. And that's at that moment, right after we came back from the election, I said, let's have the ad hoc committee. Let's do this. The first thing I did when I was House Leader, to say, let's have a process so that these documents can be looked at by Parliament and make sure that anything that's redacted, that if we can get around those redactions and show people that information, because it's so important. There was so much falseness.
But that was not your government's initial reaction.
And misinformation.
But that was not, and I'm not disputing that.
But Vassy,
but you left the vacuum for that to happen.
The initial reaction, yeah. Well, but the initial reaction was to use the committee that was created for the purposes of looking at national security documents. And so, the opposition said no. And what they wanted to do is use a process of table dropping it to the clerk with no controls, with people who have no experience in dealing with national security documents. That would have been terrible. It would have set a terrible precedent for, can you imagine being an employee of the House of Government and your personal confidential information could just be taken by Parliament and with no controls? I mean, that would have been reckless and totally irresponsible. So yes, there was a debate about that, and to get around that debate, that's why I said, let's create the committee of parliamentarians, this ad hoc committee, so that we can get around that and get to a process that gets answers.
And in the middle of it, you went to court.
What I'm disagreeing with Vassy is that, well, because as I said, the process that was being suggested by Parliament, instead of using the committee that was created for this, would table drop this information in a reckless and irresponsible way. And so to get around that conflict, when I was House Leader, I said, let's do the right thing. Let's find a middle ground. Let's find compromise. We're talking about national security here. We shouldn't be having partisan differences. Let's create this committee of parliamentarians that can look at this and can put to a panel of arbiters who are not politicians, who have no partisan interest. Let them decide what should go public and why. And I want to commend them for their work. They waived the normal considerations around protecting employee information. I think that actually was really appropriate in this case, so that all the misinformation that was spread about this could be dispelled, and so that we could see that there were two Canadian citizens who were eminent scientists, who had very strong reputations, who lied, who misrepresented themselves. And the Public Health Agency caught it, and those individuals are now under investigation.
Okay, my point though, Minister, was that yes, that process that you struck with the ad hoc committee ultimately did result in the level of transparency that Canadians would expect and that the opposition was demanding. But you didn't, that wasn't your first point of deferral. The first thing that you did when, yes, it was obviously not to your liking and you raised some very valid points, but you did take them to court. You did go to court to try and quash it before you went through that other process, and you could have done that. You tried to get this stuff kept from the public. That's the only point that I was making. I understand that you eventually struck that committee, but you were a member of the government that ultimately didn't decide to do that initially. I did want to ask about consequences, because I heard you yesterday on the tabling of the document say that there would not be consequences for anyone in PHAC. What about in China? Why is there any work at this lab still going on with China? Yesterday you said China is, by all evidence, trying to interfere in our domestic circumstances. Why no consequences for China, and why are they still involved in this lab?
Well, first of all, absolutely, there has been a sea change in all of our thinking with respect to China and their involvement in science and their involvement in our country is a very, very different place than it was in 2019. And of course, so is our disposition. And when we're talking about, cooperating in the event of another pandemic or needing more light non-security, where it doesn't threaten national security, light touch interaction, then through the World Health Agency and things of this nature, of course there has to be cooperation. We live in an interconnected world where these viruses can appear at any point in time, and we need to be able to have some kind of relationship. But when it comes to things that would be in a level 3, level 4 lab, when it comes to sharing anything that would be sensitive in nature, obviously we have very strict controls around that. And I think it's devastatingly disappointing that the way that China is comporting itself and other nations are comporting themselves is in this way, because we're facing things that are threats to all of humanity. We should be working collaboratively. We shouldn't be trying to seek the advantage of one nation over another. So the fact that China is behaving this way is awful, and it's a threat, frankly, to democracy. It's a threat to every member of Parliament. It's a threat to you as a member of the press. And so we have to be coordinated and united in that. And so I understand that we get heated, but let's not forget whose side we're on here. We're all against Chinese interference, and we're all trying to do everything we can to make sure that we protect this country.
But given the scope of what you just described, doesn't doing everything you can involve making sure they have no involvement in a lab where this kind of sensitive information exists? And on your point of pre and post pandemic, the two Michaels were behind bars. Your government had in its possession documents from CSIS that showed China tried to interfere in our 2019 elections. Why is China allowed to get away with all this?
Well, first of all, they're not allowed to get away with it. What we're trying to do here is protect our country, and you know the fact that that China is doing this, I can 100% guarantee you that we have all the appropriate controls to make sure they're not able to infiltrate our national infrastructure or our microbiology lab or anything that is sensitive. In 2019. Using apparently 2 Canadian citizens who were eminent scientists lied about their connection with folks in China and with their relationships. That's terrible. That's an awful thing for those Canadian citizens to have done.
But it
and I'm
shows
very
us
glad
it can
that the
happen.
Public Health Agency. Well, sure, and I think at that moment in time, you know, the idea that a Canadian citizen who is an eminent, well-published scientist, well-regarded in North America, would do something like that was unthinkable. And at that moment in time, the level of interference of China in our scientific community, them behaving and comporting themselves this way, that was not what was seen. That was not what was understood. And so, you know, I think that we have to understand that, you know, what those 2 individuals did was egregious and awful, and they are rightly being investigated. And what we have done is to make sure that in every step of the way, as foreign interference has gotten more serious, that we're doing everything to protect this country.
Okay, Minister, I'm out of time. I've taken a lot of your time. I do very much appreciate it. Thank you.
Thank you, Vassy.